Навірно, хто не знає, подавайте це моє прямого слова. Не входу пальця, а саме сподобання. Що середньо між лайкою, входу і лайкою. Я знаю, таке так буває, я вийду до цього і ставлюся в силу. Пишіть. А якщо не пропишете, контакт висуває від навчання, незалежності від його. А якщо там ви ображаєтеся, ви все одно є переводи наш лист.
Professor, we are ready to start?
Okay.
Okay, good evening, everyone. Thank you and welcome to the AB Dental live webinar, Step into Innovation. A few words about our speaker, Professor Angelo Cardarelli. Professor Cardarelli was born in Isernia, Italy, graduated with law in dentistry and dental prosthetic at the University of L'Aquila in 2007. Professor Cardarelli specialized in oral surgery at the Sapienza University of Rome in 2010. He is an adjunct professor and a tutor at the San Raffaele University of Milan. He is a scientific advisor of the dental clinic at the Department of IRCCS in San Raffaele in Milan. He works in Milan and Isernia, where he practiced implantology and oral surgery, an author of many publications, a speaker in national and international congress of implantology and oral surgery. Professor Angelo is a member of the San Raffaele Implant Cultural Association, the CIMO, and a member of the IAO, Italian Academy of Osseointegration, and of course, a member of the International Extraction Academy of California. Last but not least, Professor Angelo, he's an AB Dental key opinion leader for many years. We want to wish him good luck. Please, Professor, the stage is yours.
Thank you very much, Elik, and hello, everyone. It's a great pleasure for me today to have so many doctors and colleagues from different parts of the world, from different countries. So thank you again for joining us this live webinar about the new solution that we can find in AB dental products in order to treat our patients, in order to achieve the best result for our patient. So first of all, especially for the new AB customers, I would like to spend some words about the AB dental world. Because as you know, in AB dental portfolio, we can find different kind of implant, long implant, short implant, different prosthetic connection with different application. So actually, we can say that in AB dental, we can find all the solution in order to treat our patients. Also patients in which we don't have enough bone in order to treat with the standard implants. And for this reason, also we will speak about the customized implant and the subperiosteal implants. But later on, I will introduce this new concept and this new amazing technology and new amazing technique that we can use in our daily practice. So as I told before, in AB dental, we can find different type of implant, narrow implant, implant with internal connection, hexagonal connection, as you know, one-piece implant, implant with the conical connection, the new amazing ion implant. And I will show some cases in order to understand how we can use this new implant in terms of the surgical aspect and the prosthetic aspect. And then we will talk about the customized implant, the new era in order to treat atrophic patients. Regarding the shape of the implant, we have several types of implants. In each one, we can find different advantage. And we need to use this kind of implant according to the quality of the bone. So, for example, we will have I5 implant, I55, I22, I10 with different shape. We have the more aggressive implant called I5. I love it. And the indication is in the maxilla. Why in the maxilla? Because as you know, usually in the maxilla, the bone is D3, D4, so we have soft bone. And sometimes it's difficult to achieve the primary stability to deliver the immediate restoration and the immediate loading. But using the I5, we can achieve this result also in poor quality bone. So for example, I'm using, and the indication for I5 is the maxilla, the soft bone, also if we have a poor quality in terms of the bone quality. So we can achieve easier the primary stability using I5. Then we have I55, less aggressive treats. For example, we can use in the mandible, because as you know, in the mandible, sometimes we have more cortical bone than compared with the soft bone. That's why we need to use a less aggressive treats, and we can use I55, for example. So just to follow the protocol. Why I would like to introduce this concept, because if we will follow the protocol and if we will choose the correct implants, we can achieve the best result in all the condition that we can have in our daily practice. This is, for example, the I5, as I told before. Another indication is in the sinus lift, because as you can see, we have aggressive treats, but also the apex is smooth. We have a flat apex, means we can achieve the sinus membrane without any perforation. So another indication of the I5 is the sinus lift, the crestal approach. I55 again is less aggressive, as I told before, so the indication is in the mandible. I22 is less aggressive again, and also you can see the shape of the treats is a little bit different, so we can use also again in the mandible and also for the immediate loading, because we can achieve easier the primary stability. The I10, another shape. The indication of this implant according to the shape of the neck is the aesthetic area. So we can use, for example, this implant in the aesthetic, in the frontal area, in order to achieve the best result in terms of the aesthetic and the function. And beside this kind of implant with the internal and hexagonal connection, now we have also another option in terms of the prosthetic connection and in terms of the treats shape, the new ion implant. In the ion implant, we can find a new conical connection and also have a look, the treats are very aggressive treats. So the indication is again the maxilla, but also the indication is in the immediate implant placement in the fresh socket. I mean, immediate implant placement in the molar area, for example, in the upper and in the lower. Why? Because with this shape, we can achieve the primary stability also in extreme case after the extraction in the molar area, especially in the lower jaw, considering the anatomy of the bone septum. Sometimes it's not easy to prepare the implant site and to achieve the primary stability, but using the ion we can do, and also according to this kind of conical connection, we can put the implant 2 millimeters below the bone. Because with this conical connection and the switching platform, we can put the implant below the bone and we can allow the grow the bone around the neck of the implant. This is an amazing thing considering the ion implant. So in the ion implant, we have a new concept in terms of the treats, but especially in terms of the prosthetic part. So we have a conical connection. And as you know, in the conical connection, we can achieve a better sealing. So we can have a better closure in terms of the bacteria infiltration inside the implant. So we can have a better stability in terms of the hard and soft tissue. And also, according to this kind of a connection, we can reduce the micro movement between the abutment and between the implant. This is an amazing result using the conical connection. And also, as you can see in this short video, another amazing thing is the multi-unit abutment that we can use in ion concept, for example, in Holonix procedure. With this switching platform shape, we can manage better the soft tissue. Sometimes if we are putting in the posterior side, according to the Holonix procedure, the tilted implant, the posterior implant, sometimes it's difficult to put the multi-unit abutment because we have the bone around the neck. So sometimes it's difficult to screw the standard multi-unit abutment. But here, with this new multi-unit abutment, with this switching platform shape, we can achieve easier this result, and we can put easier the multi-unit abutment on the top of the implant, and we can have a better result in terms of the soft tissue shape. And those are the resume concept about the new implant, ion implant. So this is a hybrid prosthetic connection. The indication is in the difficult case in which it's not easy to achieve the primary stability, and we can put the implant below the bone. So especially for the new customers for the new users about the AB dental products, don't forget that we need to follow the implant site preparation according to the quality of the bone. What I mean, don't forget that if we are preparing the implant site in the maxilla, usually we need to under-prepare the implant site between 0.5 to 0.7 millimeter. Why? Because we need to achieve the primary stability. In the lower jaw, and here you can see in this picture the protocol that we need to follow using the AB dental implants. In the mandible, sometimes we need to prepare sometimes more, especially if we have a cortical bone. Why? In order to avoid the pressure on the bone and in order to have a better blood supply. Because if we will have high torque in section and high pressure between the treads and the bone, we will lose the bone and we will have bone resorption. And basically in the surgical kit, and another important thing is that you can use the same surgical kit for internal connection and for ion. The difference is in the prosthetic and in the drive that we can use in order to put the implant in the bone. But the surgical kit is exactly the same. And we have two different kinds of bars, without stop and with stop. Okay, so you can find all solutions in order to place this implant. So how we can use, for example, this kind of surgical kit if we want to prepare the implant site in the mandible? Just to see this short video about the implant placement in the mandible, okay? Using the surgical kit, AB surgical kit, using the sequence of the drills according to the protocol. So we will have at the beginning the pilot drill that we will use in order to make the first perforation on the cortical bone, so just few millimeters. Then we can use the other drills, and with the second drills, we will fix, as I will show in this short video, the final length. And another important thing, and you can find in the surgical kit, is the use of the parallel pins. The parallel pins are mandatory if we want to put the implants in the right way, I mean, from the prosthetic point of view, because as you know, our final result, it will be the prosthetic rehabilitation. That's why don't forget that we need to use always the pin. So have a look. This is the first drill, the pilot drill that you will find in the surgical kit. For ion, for I5, I55 is the same. This is the second drill, the white drill, that we will use to fix the final lens. This is the surgical step. Then, as you can see here, I'm putting the pin. Why? Because I need to be parallel, and we need to put the pin always after the second drill. Then we need to check the parallelism. Otherwise, it's too late if we need to change the inclination of those implants. So don't forget, we need to use always the parallel pin after the second drill. Then we can put the implant without irrigation, as you know, the same protocol, okay? Using the surgical motor, okay? And again here, we need to follow always the parallelism. So also the surgical kit from the ergonomical point of view, it's very easy. Also, we have different colors, so you can recognize very easy the different diameter of the implant. This thing is very important during the surgical procedure, so don't forget this thing. Beside those implants, we have this amazing solution for atrophic patient, customized implant. I think actually is the present and in the is the future in the atrophic jaw rehabilitation. And I will show why. So just to introduce this concept, this is the new titanium framework called customized implant that we can use in atrophic patient in which we don't have any kind of solution, no bone regeneration, no zygomatic implant. No, why not zygomatic implant? Because with the customized implant, we can reduce the invasivity, we can reduce the morbidity. And if we have some issue, it's easier to solve and to manage those issues. So don't forget this thing. And if you want to have more, if you want to learn more about this new procedure, I would like to spend just a few words about this new amazing opportunity that we will have here in Italy. It will be the first course on cadaver head about customized implant. And also we will have the day after the live surgery, so you can see how we can use the customized implant in our daily practice. So the day before, we have the opportunity to do this surgery on the cadaver head. So for each head, we will have the customized implant. So each doctor, we will make the surgery on the cadaver head, flap procedure, soft tissue management. Then the day after, we can see on the patient, on the real patient, how we can manage this new technique, this new solution, especially in the patient in which we don't have enough bone. Because as you know, if we have a patient like this, we can have different solutions. One of these solutions is all on X, as you can see. We can put 4 implants, okay? And actually, in AB Dental, finally, we have also pterigo implants and long implants. If we have a case like this, huge bone resorption, in which we have bone only in the anterior side, we need a long implant, like this, 4.2 per 18 in the posterior. Why? Because with the 18 implant, we can achieve the primary stability on the nasal basal bone area, where the quality of the bone is higher compared to the posterior side of the maxilla, in order to have more than 35 Newton in terms of the primary stability, in order to make immediate restoration, immediate loading, okay? And as I told before, have a look here. We are in the maxilla. So as I told before, according to the protocol, we need to prepare less. Why? Because we need to increase the primary stability. In the mandible, sometimes we need to prepare more just in the coronal part, in order, as I told before, to reduce the pressure between the treads and the bone. Then we can put the multi-unit abutment. In this case, you can see the standard multi-unit abutment, but I will show another case in which we are using ion implant with the new multi-unit abutment. And you will see, and you saw now the difference between this case treated with the internal connection and the other case treated with the ion implant, in order to understand the difference. And as usual, if we have more than 35 Newton, we can use the digital impression. So we have also the digital tools, the scan body that you can find in AB Dental portfolio, all kind of scan body that we can use for deliver in the case like this, as I did in the case like this, the immediate restoration in this patient 85 years old. So old patient only for implants in order to reduce the invasivity. Another option is the bone regeneration, as you can see in this case. But can you imagine the invasivity of this procedure? So actually, if we have a case like this, I will use 100% the customized implant. Why? Because in only one surgery, we don't need bone regeneration. We can reduce the invasivity. We will have, from the CBCT, we will have a very precise titanium framework. For the first time, we can produce this titanium framework from the titanium dust. Of course, we have also the zygomatic implant, but be careful, because with the zygomatic implant, it's difficult if we have some issue to solve, to manage the infection, to manage the sinusitis, because in 35% of the cases treated with zygomatic implant, we have a lot of sinusitis, infection inside the sinus. So I think compared with the zygomatic implant, the customized implant is a new solution in order to reduce any kind of issue and in order to have reduce the morbidity for our patient. So the important things when we are preparing the bone for the implant is to know the anatomy. And as I told before, in the maxilla, we need to have aggressive treats. So I prefer to use I5. In the mandible is the opposite, so we can use I55. But the important thing is that in the maxilla, we need to achieve the bicorticalism. So we need to achieve the primary stability on the crest and also in that area, like nasal area, in which the quality of the bone is higher, like this. In the maxilla, those are the areas that we need to prepare the apex of the implants in order to achieve the primary stability. That's why sometimes in the posterior side of the maxilla, we need to have a long implant to achieve the primary stability. Otherwise, it's not enough for the immediate loading and for the immediate restoration. And again, this is the reason, as you can see in this image, this is the reason that we are doing a lot of course on cadaver, because on cadaver, you can see the anatomy, you can understand. So on the cadaver head, you can see the anatomical structure that we need to manage. For example, on the customized implant, we need to know how we can cover the customized implant with the soft tissue. And the cadaver head is the only way in order to understand and in order to learn about that. Sometimes, have a look here, sometimes we need to open the nasal cavity. Again, the anatomy will guide our procedure. So another option is to achieve the primary stability on the nasal area. That's why we need to know exactly the anatomical structure in order to manage perfectly, okay? Because if we have a case like this is our daily practice. So the patient came with a lot of perio problems in the both arches, upper and lower. Have a look at the situation before. A lot of infection, gummy smile, residual root, so no way. We are starting the upper, then we need to treat also the lower, but now the priority is the maxilla. And again, open flap procedure. Why? Because if you see this case after the open flap, you can see a disaster. No bone at all. But we need to find the bone also in this case. That's why we need to open the flap. And as you know, in the Olonix, it's mandatory to make the ostectomy in order to place the implant. So I place it 4 implants, as usual, 2 long and 2 tilted in the posterior and 2 straight, and 4 multi-unit abutment. This is the standard multi-unit abutment. 30 degree in the posterior and straight in the anterior. The scan body that you can find in the AB catalog for multi-unit abutment in order to take the impression, and the healing cap for the scan body. So if we are using the multi-unit abutment, we need to have all the tools for the multi-unit abutment. So multi-unit abutment, scan body for multi-unit abutment, healing cap for multi-unit abutment, digital analog if we are using the digital way for the multi-unit abutment. Don't forget this thing is very important. And this is the immediate loading, just 48 hours later, only for implants, no bone regeneration. Have a look also the result, just 2 days later. And this is the temporary. Okay, this is the temporary. So if we are using the digital workflow, and actually I think the digital workflow is the best way, just to put the multi-unit abutment, then the scan body, we can take the impression, is very fast and very easy. Then we can send our STL5 to the dental technician, and within a few hours, we can receive this temporary restoration, 4 implants on multi-unit abutment, standard connection, okay? Within 2 days, then it's very easy to screw and to deliver the immediate restoration. So for example, this is the all-on-4 procedure using only 4 implant and the digital workflow. Only 1 surgery, only 48 hours to receive this temporary. So we will have immediate static, immediate function, means immediate restoration. Also in the case like this, in which we don't have enough bone, but we can find the bone on the palatal side and using a long implant, okay? And actually in AB also we have the possibility to use also the pterigo implant, so we can achieve the primary stability if we don't have enough bone in the anterior, also in the posterior, using the pterigo implant. And this is the temporary, okay, that we can receive. Some details about the temporary. You can see the shape of the temporary is very important to have a good shape to allow the healing. But I want to show this picture about this case. If you see the occlusal view, have a look here. We don't have bone, but we can find bone on the palatal area using 2 long implants with aggressive treats. That's why the aggressive treats we will use in the maxilla to achieve the primary stability. And then we can use the multi-unit abutment and the healing cap on the top of the multi-unit abutment and the scan body on the top of the multi-unit abutment to take the impression and also evaluate the healing. This is the healing only 2 days later. Means less invasivity for our patient and immediate aesthetic and immediate function. This is the OPG after the surgery, 2 days after the surgery. So we have 2 long implants, aggressive treats, and 2 straight implants on multi-unit abutment, okay? For all on X, using the standard connection. Anyway, with this protocol, we can reduce, of course, the invasivity, and we can treat also old patients. Same result in terms of the aesthetic and function and less invasivity. So if we don't have enough bone, just to tilt the posterior to achieve the primary stability. That's why it's important to follow the implant site preparation protocol if we are planning to treat the maxilla and also the mandible. So we can say that this kind of rehabilitation is a predictable rehabilitation. But have a look how we can treat case like this using the ion implant, long implant. All the patient came with this huge infection in the upper. So the only area that we can use is the anterior. Have a look here, huge infection, as you can see from the CBCT. Infection from the intraoral view. So no way, we need to remove all of them. This is the situation before. Have a look. Again, the same procedure, open flap, ostectomy, then implant placement. And I will show fast this procedure using ion implant. So as I told before, we can use the same surgical kit. The difference is in the driver that we need to use to put the implant in the bone. Why? Because the connection is different compared with the standard connection. But the kit is absolutely the same. And of course, we need to use a different multi-unit abutment with a different shape. And here, in this case, you can see, and you can understand better the difference between the ion conical connection implant, conical connection prosthetic parts, and standard connection. So we will use different multi-unit abutment, different scan body, of course, different healing cap, different digital analog, okay? But the surgical kit is exactly the same. And also in terms of the implant site preparation, as I told before, and as you can see from this video, in the ion implant, we have a very aggressive trails, mean it's easier to achieve the primary stability. Also in the case like this, in which you can understand that we have not a good bone quality. That's why we can use this implant to improve the primary stability. So 2 long implants in the posterior and 2 straight in the anterior. And also compared with the standard connection, for example, the I5 that I used in the previous cases, with ion connection, we can put the implants between 1-2 millimeter below the bone. And we can have a grow bone, the grow of the bone around the neck of the implant. And also it's easier to put the multi-unit abutment because we were switching platform, okay? So we don't have any problem in terms of the, in order to place the multi-unit abutment on the implant, also if we are putting 2 millimeter below the bone. Also in this case, you can see here, we have thickness, but we don't have enough height. That's why, as usual, we need to open more. Again, the anatomy will guide our surgery because we can understand the anatomical structure. We can open buccally and palatally. Okay, I will go fast just to show the open flap procedure like this. So we can do the ostectomy. Have a look here, the nasal cavity. And on the palatal side, we have the nasopalatine area. As I did before, always don't forget that in all onyx, we need to perform the ostectomy. The protocol is the same. The difference is in the implants, because here we will use ion implant, okay? But so far, the protocol is exactly the same, and the surgical kit is exactly the same. As usual, we will start always from the posterior part, then we can go ahead with the placement of the straight implant in the frontal area after the ostectomy. Okay, this is the same protocol, nothing different. So we can start with the pilot drill. It's the same kit. Then with the second drill, we can fix the final length. In this case, we have 4.2 per 16 millimeter ion implant. Can you see here? The kit, the pin are exactly the same, nothing different. The drills are the same, nothing different. Okay, so far is exactly the same. When we will use the last drill, we can decide to use the last drill only a few millimeters. Why? Because we can feel that we don't have enough cortical bone. So I want to achieve easier the primary stability. Okay? So we are using these drills for full length. Then we can decide to prepare just a few millimeters to put the implant. This is the ion. Have a look, the shape is different compared to the previous one. And you can see here, when we are placing the implant, the primary stability that we can achieve easier. Here we are about 40 Newton. Then we can finish the implant placement with the surgical motor or manually. Using, you can see here, the difference is in the driver, because we have a conical connection. And here we are putting the implant 2 millimeters below the bone. This is the difference. The same on the left side, the same sequence, the same implant, 4.2 ion per 16 millimeter. Have a look here, poor quality of bone, but the same primary stability, okay? Have a look here. The aggressive traits, okay, 40 Newton. So we can complete here manually or just to increase the torque on the surgical motor. It's up to you, but the important thing is to see that we are putting below the bone. Then we can place in the anterior. Is the same concept, just to go palatally is the same, so we can go forward. The same pin, the same procedure, and 4.2 per 13 millimeter ion implant. 2 millimeter is immediate implant placement in the fresh socket. So 2 millimeter below the bone. Again, high torque insertion. High primary stability means immediate loading. Okay? Then we can finish as usual manually to put 2 millimeter below. Now the difference is in the shape of multi-unit abutment. So we will use two 30-degree multi-unit abutment in the posterior and two 70-degree in the anterior. And here you can see here 2 millimeter below the bone. Okay. Then now you can see the multi-unit abutment, the shape of those multi-unit abutment is different. 17-degree in the anterior, okay? So we don't have any problem from the bone, and in the posterior, 30-degree, okay? Now we can put the healing cap. You can see the color of the healing cap for ion is different. So you can recognize different healing cap because we have a different multi-unit abutment. And of course, different scan body. We can't use the same, of course, from the prosthetic part. We need to use a dedicated scan body for ion. But the procedure is exactly the same. So we can manage the tissue, we can go fast, we can make the suture around the healing cap. Have a look here. The scan body for ion. If you remember the previous case, it was different because those are the scan body for ion. But the procedure is exactly the same. And then we need to send to our dental technician the digital analog for ion. Okay? Then we can take the impression as usual. The same protocol, nothing different. Okay? The difference is in the placement of the implant 2 millimeter below the bone, in the shape, in the better shape of the multi-unit abutments. That means better soft tissue healing around the multi-unit abutment, especially in the posterior side, where sometimes we don't have enough keratinized tissue. So it's the same. We can send, and have a look here. This is the temporary. Exactly the same procedure. Okay? This is just 2 days later. Okay? So the protocol is the same. You can see here the 3D printing model, the digital analog for ion on the 3D printing model. Then it's very easy to put and to screw the temporary just 2 days later. Okay? But I want to show, is very interesting. This is the temporary, okay? It's perfect, perfect fitting. Also, the impression was perfect, so we don't have any problem. Also, the occlusion was perfect. So we can screw and we can deliver this temporary, okay? So this is the resume about this surgery. This is the important things. Have a look, the shape of those multi-unit abutments is amazing. Sweet platform, better shape for the soft tissue. And all the tools that we can use for this kind of multi-unit abutment, including the scan body. But have a look. If you see this picture about this case, just a few hours later, can you see that around those multi-unit abutment, we have a nice soft tissue shape, means better healing, okay? According to this new switching platform shape, okay? And I want to show that this is the template that I already showed before. I want to show the healing after the osseointegration. Around, this is the temporary, right side and left side. This is the lateral view. This is the temporary, okay? And this is the X-ray, okay? 4 implant, like all on 4, but with ion. Can you see the difference in terms of the shape of those multi-unit abutments? Is different compared with the standard. You can see here the switching platform. This is the important things, because here we are putting the implant below the bone, so we can allow the growth of the bone around the neck of the implant. This is one of the difference compared with the standard connection, okay? Evaluate the healing, the occlusal view. Can you see the amount of the soft tissue that we have, especially in the posterior? Have a look here. Enough thickness here, here, here. Have a look here. The amount of the keratinized tissue means long-term stability. Is very important for the soft tissue. Okay, it's not only related to the osseointegration. Then it's very easy to go forward and to finish this case, to deliver this case with the final screwed ceramic Toronto on all on 4 procedure. This is the final case. But the important thing is to see that we can use ion not only for the surgical point of view, but also for the soft tissue healing. It's very important in this kind of rehabilitation for a long-term stability. And then this is the final case, okay? So screwed only for implants, like all on 4. This is the final X-ray. Have a look at the stability here. Switching platform. The bone is here. Here. This is the difference if we are comparing with the ion implant. And also we can treat both arches in the same surgical procedure. If we have a patient like this, patient with perio problem, as I told before, in this case, and again, in AB Dental catalog, we can find also short implant. So have a look at this case, in which I used 6 implants, but 4 implants, like all on 4, like normal and standard all on 4, and also 2 posterior, like short implant. I will show. So we have 4 implants, 2 long implants in the posterior, 2 in the anterior, and here you can see 2 short implants in which I did crestal sinus lift. Okay, why 6 implant? According to the patient, according to the age of the patient, according to the muscle of the patient. So in this case, I prefer to have more implants for the stability. But I did immediate loading only on 4 implants, not on the short implants. This is the same protocol. So I5 implant, healing cap, and have a look again. It's very interesting to see this video. This is only 3 days later when I removed the healing cap on the multi-unit abutment to place the immediate restoration. And I did upper and lower. So upper I did all on X plus 2 short implants. In the lower, I placed 6 axial implant with the straight multi-unit abutment. 2 different kind of rehabilitation, but have a look at the healing. Only 3 days later is amazing. Okay? And this is the temporary multi-unit abutment on the upper. Okay, and I did in the same day also the lower, but in the lower we have enough bone. So what I did, I placed 6 implant, I-55, mandible, if you remember, less aggressive traits, no tilted implant. Why? Because we have enough bone. So 6 axial implant, and I put it on the top 6 straight multi-unit abutment. Okay, like this, and 6 scan body for the impression. Have a look. The important thing, as I told before, when we are using the drills, after we need to check the inclination with the pins that you will find the surgical kit for the prosthetic point of view. And this is the temporary on the lower, on 6 straight multi-unit abutment, straight implants. This is the digital analog for internal connection. And again, evaluate the healing. It's amazing. Again, after 3 days. Okay. 3 days later, just to put the temporary, upper and lower, okay? Like this. Then we can screw manually. Then we need to, don't forget that we need to make with the key, we need to make the torque, okay? Manually, it's not enough. We need to use the key for the torque, is mandatory. And this is the temporary on the lower, okay? 6 implant. You can see the shape of the temporary, of course, and this is before and after, okay? So we have 6 implants in the upper, 4 implants like all on 4, 2 short implants, but I will show the X-ray, and 6 straight implants in the lower, okay? This is before and after 3 days. Have a look at the X-ray. Can you see? 6 lower straight, all on 4, and 2 short in the posterior. This is the healing after the osseointegration on the multi-unit abutment in the lower, the prosthetic part, the titanium bar, all the prosthetic procedure. And this is upper. So upper we have 4 and 2 short implant in the posterior. And I put the 2 straight multi-unit abutment. Then we can take again the impression, prosthetic part. Is important to check if everything is correct in terms of the aesthetic, okay? Then we can deliver the final screwed restoration, upper and lower, okay? This is the final, like this, okay? Upper and lower in zirconia, both in zirconia. This is the final restoration. If you remember the beginning, this result is a good result for us, but also for the patient in terms of the aesthetic and in terms of the function. This is the final X-ray. So sometimes we need also a short implant. Okay, so we have all the options that we need to have in order to treat a patient like this. Okay, and again, another case that I treated with I-55 is old patient. Again, the same things. But again, this is another option. Without multi-unit abutment, with indirect connection using the T-base. This is another prosthetic solution. So 6 straight implants. And can you see here the difference in the scan body shape? Why? Because in this case, I used direct connection with the T-base without rotational T-base without multi-unit abutment. But the protocol is exactly the same. The difference, have a look here at the temporary. This is the temporary 3 days later. Have a look at the OPG. I-55, 6 implants. I-55, no multi-unit abutment, direct connection with direct T-base in implants. This is another solution. Have a look here. Those are the T-base. So in this case, we don't have multi-unit abutment, and evaluate the healing after few months later. So we have direct, this is the standard connection on I-55, but have a look also the healing of the tissue. It's nice. So it's very easy to deliver the final restoration screwed without multi-unit abutment, but here you can see different height of T-base according to the soft tissue, okay? So direct connection on implants, no multi-unit abutment. This is another option. And this is the final. And you see here the stability, no multi-unit abutment, direct connection on the top of the implant. Okay? But if we have a huge resorption, actually, how we can treat this patient? As I told before, bone regeneration, of course, is invasive. Also, we need to consider general anesthesia. Zygomatic implants, okay, I don't like it. Why? Because if we have some problem, it's difficult to manage. So actually, we have another solution using customized implant and subperiosteal implants. So if you have a case like this, have a look, huge bone resorption, no bone at all, in terms of the height, in terms of the thickness. How we can proceed? Just to take the CBCT and the digital impression, then we can send our file in high resolution to AB Dental. Then we can receive the project and we can see the project. Then we can receive the customized implant, okay? Have a look at the 3D printing model in order to understand that in this case, the resorption is so huge. We don't have bone. In order to treat with the normal implant, the solution could be bone regeneration, zygomatic implants. But in this case, I used customized implant. Okay? Have a look here. This is the 3D printing model. It's amazing. We have this 3D printing model, and here you can see the customized implant to treat this patient. This is a full arch rehabilitation with 2 customized implants, not only one piece. Why? Because we prefer to divide in order to reduce the forces. Okay? So it's better to have 2 pieces like this. And we have 6 multi-unit abutment, means all on X, but on customized implant. Okay? So we can receive this 3D printing model. It's amazing. It's very, very precise. And in this case, we have 23 screws in order to fix and in order to stabilize those customized implants on the top of the bone with 2 long screws in the zygomatic area. All of them are 1.2 in terms of the diameter, different lengths according to the residual bone, according to the CBCT. I will show the short video about this surgery, but the important thing is to see this result. After the placement, perfect fitting between the customized implant and the bone, no space, no gap, means high precision, means high stability. Okay, that's why it's very important to show this. Have a look also the 3D reconstruction. This is the short video, just to understand. Okay, the difference is obviously in the open flap procedure because we need to open a little bit more. Why? Because we need to see the zygomatic area, because I want to fix 2 screws in this area to improve the stability. And we have one side and opposite side. Okay, just to put on the bone is already stable. Is already stable. So it's very easy to put on the bone and to put the screw, different lengths, the same diameter. This is the last screw in the zygomatic area, but now it's already stable. And we have some screw also on the palatal side. That's why on the cadaver head, you can do exactly the same. So you have the possibility to open the flap, to understand how we can put the customized implant, but especially how we can cover with the soft tissue. Usually this tissue is fat, the fat that we can have in the thickness of the cheek. And on the cadaver, we will show how we can release this tissue to cover the customized implant. And also in the lower, how we can move the lingual flap to cover the customized implant. Because this step, the sutures and the soft tissue management is one of the important thing. Because if we don't have enough passivity in terms of the soft tissue, we will have the exposure. Okay? That's why on the cadaver head, the important thing is to see how we can manage the soft tissue. It's not only to put the screw on the bone, but the important thing is the soft tissue management. This is the case. To customize the implant, have a look, the occlusal view is perfect. Perfect fitting in both sides, means high precision. Then we will have six multi-unit abutment, like all on six. Is exactly the same from the prosthetic point of view. No difference. We can do the same. Digital impression, scan body, like this. Then we can do also immediate restoration. So we don't need to wait time. We can do exactly the same. We can do immediate restoration, just to take the impression, like this. Is exactly the same. Then we can deliver our temporary on 6 multi-unit abutment, okay? And this is the temporary. So I think actually using this procedure, we can treat also a case like this, extreme case. This is the OPG. Can you imagine that in only one surgery, we can solve the case? We can solve the case. So we can reduce the morbidity. And also in only one stage, we can deliver the immediate restoration. It's amazing. And of course, if we have some problem in terms of the soft tissue exposure, it's easier to manage. Because if we have some soft tissue exposure without infection, we can keep like this, just to check the patient, just to clean the exposed area. If you have, in some case, exposure with infection, we can cut some part of the customized implant or we can take out. But can you imagine if we have some problem on the zygomatic area, on the zygomatic implant, it's a huge problem. Sometimes we need to send the patient to the hospital. So the management of the issue, it's easier with the customized implant compared with zygomatic implant. So sorry for this short lecture. I think it's just a few, it's just an appetizer about all the solutions that we can find in AB Dental. And again, I would like to invite all of you to join our next cadaver course in September, because I think it's a great opportunity to share our experience, to share our knowledge, and to understand how we can perform the surgery according to the anatomy. Is the only way to improve our knowledge in implant field and in the surgical field. So thank you again, and if you have any question, please feel free.
Thank you very much, Professor Cardarelli, for your great lecture. To all the doctors that have attended, AB Academy will continue to share the webinars, the programs, the courses. You can visit AB Dental Portal, and we will share with you the information. Thank you very much. שלי, אם את יכולה לפתוח את המיקרופונים, שאנשים יוכלו לשאול בבקשה שאלות. Please feel free to ask Professor Cardarelli any question needed.
And also, of course, Eric, in September, beside the customized implant, we will have also the possibility to show and to show the use of the new pterigo implants on cadaver.
Dr. Sharma from India is asking regarding the presentation. Yes, we will upload this recording of the webinar to AB Dental website, sir. No worries about that.
I can see some...
Yeah, in the chat you have a question, Professor.
I'm seeing something. So...
Dr. Yamir.
Yamir is asking that subperiosteal is available in India. I think so.
The answer is yes, it's available. Look, his last question. As a maxillofacial surgeon.
No, not another question. What are the chances of the screw losing in this customized implant? This is a right question. That's why, as I told before, if we are doing full arch, we prefer to split in two parts in order to reduce this risk. Because if we have two pieces, we can reduce the risk of losing the stability of the screw. Of course, that's why in huge case like this, we need to use two customized implant, not only one piece. Another question. Is there training available for PSI implants in India? Eric, what we can say?
We can arrange a training in India. Of course, our local manager, Mr. Itai, will share with him the information and can invite him to the course in Italy, Professor, also.
As maxillofacial says, is screw loss intra. So far, according our follow-up in this kind of rehabilitation, we don't have any kind of problem related to the screw. Why? Because we are doing a precise CBCT, and also the important thing is to plan correctly. The screw placement is important to see and to decide the exact shape of the customized implant according to the residual bone. So if we have a perfect plan, we don't have any problem according to this issue. But so far, we don't have this kind of issue. Any course in US?
Dr. Slavin, regarding the courses for the US and Mexico, we will share with you the information about that shortly. You're welcome, sir.
Regarding the scanner, for the scanner, I'm using in my practice, I'm using 3Shape. I think 3Shape is a good scanner, is fast and precise. With 3Shape so far, I don't have any kind of issue.
Any more questions, doctors?
About the FDA approval, there is a question. I think, Eric, you can answer.
When will the FDA approval in the US? We are in a final registration process. I think we will soon give you, let's say, the good news about the FDA. We are now in the final preparation for that. Okay. Dr. Khan from India, we will share with you information about this. No worries.
And come to Italy to join us.
Of course. Professor Cardarelli and all the dear doctors, I want to say thank you very much. One more question from Dr. Gilad Bardayan from Israel, Professor.
Yes. The soft tissue exposure is the important things. Of course, we need to spend time to talk about that. The important thing is before, the first thing is to have a good closure. So in the maxilla, we have the fat that you can find in the thickness of the cheek, and using this fat, we can reduce the risk of the exposure. But you need to know exactly how we can release and how we can achieve this fat in order to cover, in order to create this double layer with the fat and with the flap. Of course, in the lower jaw, we don't have fat. The only thing is to move, as we can do in the vertical bone augmentation, is to move the lingual tissue, the lingual flap, to cover the customized implants. But we need to know exactly how we can do, okay? Then we can talk about the exposure. As I told before, we can have two different kinds of exposure. Exposure without infection. So it's easier just to check the patient, just to keep this exposure, this exposed part clean. If we have infection, sometimes we need to cut if this part of the customized implant is not involved in the prosthetic area. Otherwise, if we have a huge infection and exposure, of course, we need to remove. Okay, so we have different scenarios according to the issue that you have. Okay, but the important thing is to prevent this exposure, and we can prevent from the beginning, from the incision and from the suture, from the soft tissue management before and during the surgery. Otherwise, after it's too late.
Another question from Dr. Gilad Bardayan from Israel. Professor?
Yes, of course, you can add some material, but as you know, if you are adding some material, it's just to put something to cover the customized implant. Is an option. Honestly, I don't do. Why? Because I prefer to put some material that can cause infection between the customized implant and the soft tissue. So sometimes this material can cause the infection, okay? But yes, you can cover, but in my procedure, in my practice, I don't use material to cover the customized. I'm using fat and lingual flap in the lower.
Thank you, Professor. I know Dr. Gilad Bardayan was waiting to see you in the visit to Israel, and we will meet. And also, I think, Dr. Gilad, you were interested of joining the course, so maybe we can speak about it later.
Okay.
Dr. Gilad. Dr.
Yes, it's a question about PRF.
Yeah.
Of course, you can use also PRF like membrane. PRF is a nice idea because you can use PRF plus, especially in the lower jaw, because in the lower jaw we don't have fat. So of course, PRF is a nice solution that you can use to improve the stability of the soft tissue, of course. PRF, it's better than some, xenograft or some material. So better PRF than some material for the infection.
Excellent questions. Any more questions, dear doctors? Okay. Professor Cardarelli, thank you very much for taking your time preparing this excellent presentation. This webinar, ladies and gentlemen, will be uploaded to AB Dental Portal, and we will share the link with all the people that have attended today. AB Academy will continue and share knowledge and professional academic programs to our customers around the world. Thank you again, Professor Cardarelli, for your great talent, for the patients, for the professional information you gave to our dear doctors. Have a great weekend, and we will see you soon. Thank you very much.
Thank you very much, and see you in Italy very soon. Thank you.
Thank you. Goodbye, everyone.
Thank you.
Thank you very much. Bye-bye.